Hi, I'm Ami. I recently supported my friend Rose through an abortion, but now she's worried about getting pregnant again. In this video, we will talk about the possibilities of pregnancy after an abortion. Having an abortion will not prevent future pregnancies. In fact, you could get pregnant again within weeks of an abortion. So, if you know that you do not want to get pregnant yet, make sure you start using a reliable pregnancy prevention method, also called a contraceptive, as soon as possible after the abortion. There are many contraceptive methods you can choose from, depending on your own health and lifestyle preferences. If you're looking for methods that are reliable, easy to use, and convenient, consider an implant or an intrauterine device, also called an IUD, a loop, or a coil. These methods are more than 99% effective in preventing pregnancy. And though you will need a health provider to insert them, once they are inserted, you don't need to do or remember anything until it's time to replace them. You can keep them for 3 to 5 years for implants, 6 years for a hormonal IUD, or 10 to 12 years for a non-hormonal IUD. If you have an abortion using pills, you can get an implant immediately, or get an IUD as soon as your abortion process is complete. If you have a surgical abortion in a clinic, you can get an implant or an IUD inserted immediately. In all cases, they can be removed anytime you want, and your fertility will return to its normal state quickly. If you're not sure yet and looking for something that's quicker and easier to stop and start, that's okay too. In this case, you can consider pills, patches, vaginal rings, or injections, depending on what is available in your country. Pills need to be taken every day, and patches are changed every month. Different vaginal rings are changed at different intervals, and injections are done every 1 to 3 months, depending on the type. Most contraceptive injections are for 3 months. Some are only effective for a month. These methods are slightly less reliable, as sometimes people forget to replace them or take them on time, and this impacts their effectiveness. With typical use, these are about 90% effective. If you don't want any more children at all, there are also permanent methods that are safe and highly effective. For women, this involves a minor surgical procedure called a tubal ligation, which closes the tubes that carry eggs to your uterus. For men, vasectomies are a simple and low-risk procedure which stops the sperm from being added into the semen. Both of these will need to be done by a trained provider. Finally, condoms, whether male or female condoms, are the only method that will protect you against sexually transmitted infections such as HIV. As condoms are often not used correctly, they are only about 80% effective. But if you are worried about infection risk, it's a great idea to use a condom along with another contraceptive method for the best all-round protection. You may experience some side effects when using contraception. These will differ between women and the method you choose, but they usually improve with time as your body gets used to the method you've chosen. If you really don't like a method, don't give up on contraception. Try something else. There's a method out there to suit everyone. Join more than 840 million other women across the globe that are using these methods to help them plan the future they want. For more information, we've included links to additional videos about each method option in the description below.